morning, everyone. Amy Stein from Beyond Basics Physical Therapy in New York City, here with Dr. Robert Graziano from the Atlantic Medical Imagery Center. He is doing a wonderful video series for us and for all of our listeners out there. We so appreciate that he is spending his time and energy to talk to all of us about his journey, as well as healing techniques and healing treatments. And today we would like to talk about female pelvic pain. And although Dr. Graziano is not a female, he has educated himself. I tell him, like, if he ever wants a job here, because he knows as much as we do about pelvic pain and pelvic floor dysfunction, and I so appreciate that he's going to be speaking about female pelvic pain and what he's seen and heard in the past year.
Thank you. So everybody knows my journey with male pelvic pain. So I had gone to a course hosted by Amy in the International Pelvic Pain Society on pelvic pain, which I had seen online, and it was a lot of interesting stuff. They were talking about pain in general, men and women, but just even all types of pain. And I decided that I'd like to attend. And I've seen 75 medical conferences in my career, and this looked like one of the better ones. So I went, and it was fascinating. It was really a lot of good information about men and women and pain in general. The thing that astounded me the most from that conference and even afterwards is I didn't realize how many women were in pain, in pelvic pain. It's 1 in 6 women with chronic pelvic pain, 1 in 4 women with pelvic floor dysfunction. That just baffled me. I didn't realize that there's a whole segment of society that we're not addressing. And as a physician or a healer or whatever, it's something that I felt in my heart that I wanted to get the word out, that there's more that we can do as physicians and healthcare providers. And I think there's not enough that we're doing right now in addressing a lot of women's issues. So that's why I've dedicated myself to educating myself more and those around me.
Great. So some of the symptoms that women experience are vulvodynia, endometriosis, irritable bowel syndrome, that's men and women, painful bladder syndrome, interstitial cystitis, also men and women, and as well as just vaginal pain. Men have genital pain as well, and abdominal pain, and unexplained back pain, hip pain. Those are different symptoms that we hear. As I mentioned earlier in the series, urinary and bowel and sexual dysfunction can be involved with pelvic floor dysfunction. So urinary and bowel symptoms are typically urgency, frequency, hesitancy, incomplete emptying, as well as the stream stops and starts. Also the bowel doesn't completely empty, so they feel full. So there's a lot of symptoms that we treat, and if you go back to the previous series about Dr. Graziano's journey of physical therapy, it's similar with male and female, that we assess internally and externally. We assess and treat internally, externally. We go through postural alignment, just general alignment. We address any of those issues, neuromuscular re-education, so really retraining the body to relax when you're in states of pain. Also using the techniques that you mentioned earlier. And would that apply to women as well, using the other modalities that you mentioned?
Yeah, pain is pain. I mean, whether you're a male or a female, you still have pain. And a lot of it's very similar types of pain. So all the different things that I mentioned earlier are going to help women just as much. It's multidisciplinary. There's not just one magic pill that's going to solve everything. You need to do everything. Use all the tools in your toolbox. So yeah, it's going to apply equally to men and women. The one thing I want to mention real quickly, 1 in 10 women have endometriosis. I mean, that's an astounding number. Think of all the people you pass in a day walking in the city or wherever. 1 in 10 people you pass are going to have endometriosis. And of those people with endometriosis, there's usually almost a 9-year delay between when they really get treated. There's usually, I just read this recently, 4.5 years before they actually go to see the doctor and try and get diagnosed. And usually these women, with all due respect to my colleagues, are misdiagnosed, and there's about a 4.5 year delay to they're correctly diagnosed with endometriosis. So we're dealing with 1 in 10 women, and then 9-year delay. That's unacceptable.
Yeah, I agree. And our men are getting misdiagnosed too. Not to go on back to the male series, but yeah, it's frustrating. In my journey over, I'm not even sure you know this or anyone out there, but I've been doing this for 20 years now, and I've seen quite a change. It's still not enough for sure, but you know, before, when I was in New York City, there was one other pelvic floor physical therapist. Now there are a bunch. Granted, you have to pick and choose the physical therapist because some have more expertise than others, and you definitely want to make sure it's a pelvic floor physical therapist. And then the physicians in New York City, it's still lacking, but especially for such a big city. But I now have more than a handful of urologists and gynecologists and physiatrists that we can refer to, which is amazing because 20 years ago I actually flew out to California to a physician, Jerome Weiss, and he showed me what pelvic floor dysfunction was, and his colleague Stephanie Prendergrass, who's also a very well-known pelvic floor physical therapist. We had the journey together, and we're really determined, like you are, which is great, to spread the word and make the medical community more aware of what we can do and how we can help these women. Can you explain what were some of the things that you did that helped, that maybe would apply to the women with regard to like, did you exercise? Any mental health things that helped?
Well, again, it's multidisciplinary. I'd like to just state one thing. It is important that you go to the right people, like Amy's saying. You need, if you're going to get your gallbladder out, anybody can remove your gallbladder, so you don't have to go to the best surgeon in the city. But for something like pelvic floor therapy or physical therapy, you need people that are well trained. In fact, I forget where I read this, but for men, there was this Weiss Anderson clinic, and they noticed that there was this one physical therapist who was always getting better results in their patients than some of the others. And that's somebody that they use now. I think his name is Tim Sawyer, which you may know. Yep. But the point is, for this type of treatment, you have to go to a place where they really know what they're doing. It's important, because if you go to somebody that's vaguely familiar, I don't think you're going to get the full benefit, in my opinion. So it's important to go to the right people for something like this that are well trained. As far as things that men or women do, again, it's multimodality. I would encourage people to exercise. You have to go to the gym. Nobody wants to go to the gym. Believe me, I didn't want to go to the gym, but I made sure I went to the gym. I made sure I went to physical therapy, which every week I looked forward to my physical therapy appointment. I took some medications, like I said, Cymbalta. I'm not depressive at all, but I figured that would lower the sensitivity. I didn't do it till later on, but mindfulness, meditation, like I had mentioned, for women or men, which if I ever went through another episode, even with back pain or anything, I would rely upon that to help me. It's a bunch of things. Right,
yeah. Well, that's great. That's great advice, and I appreciate Dr. Graziano mentioning all this, because we do find that really helps. With regard to exercise, I do think it's individual. So for some people, swimming is great, or even just walking in water. What we find is at least at the beginning, a bit less aggressive. So maybe more elliptical and treadmill versus going to CrossFit and any biking, especially if you have sitting pain. And then I totally agree with mindfulness or yoga, Tai Chi, Qigong. These are all different things that people find helpful, and I think it's really what works best for you too. I think that's really important to realize, and what you'll stick with. That's another thing. And diet can be an issue, so there's anti-inflammatory diets and gluten-free, dairy-free diets that some people say really help. Some people say it doesn't help so much. So it really is dependent on the person, and each person has a different journey as well. So if you want to hear more, listen back to our series with Dr. Graziano, and we're continuing. We have a couple more, so please stay tuned at Beyond Basics PT on our social media. You could also check out our website, Beyond Basics Physical Therapy, for more information just in general on pelvic health. And my book, Heal Pelvic Pain, and video, Healing Pelvic and Abdominal Pain. Those are both great tools, as Dr. Graziano said. You need a lot of tools in your toolbox, and are the book and DVD going to cure you? No. Some people, according to Amazon, I read the reviews sometimes, and it has, but it's more likely that a multidisciplinary approach with using the book as a tool is what will be right for you. Another series that's going to be coming up is what to do at home and what to do with flares. So stay tuned, and thank you so much for being here.